Well, recently, the U.S. Surgeon General issued an advisory calling attention to the public health crisis of loneliness, isolation, and lack of connection in our country.
Even before the onset of COVID, approximately half of adults in the U.S. reported experiencing measurable levels of loneliness.
There are things you can do to combat loneliness, and UW distinguished psychologist Dr. Shilagh Mirgain is with us again. Welcome.
Thanks for having me. This was the very first interview on this topic I did with you several years ago.
Really?
No kidding.
And we're back talking about it.
So how bad is the problem?
Well, we're finding that after the pandemic, even more people are feeling that sense of lack of connection, social isolation, and loneliness. And there are impacts to both physical and mental health as well as societal health.
Can you talk about those impacts, and then how do we come out of this loneliness state?
Absolutely. So physically, we find that loneliness is comparable to smoking in terms of premature death. We find that people who are socially isolated, who lack social connection, have an increased risk, like 30% increased risk of heart disease and stroke, and a 50% increased risk of dementia. Mental health, we already know many people are struggling mental health-wise, but if you're lonely and lack social connection, we have increased twice as likely to experience depression, and an increased risk for anxiety and depression currently, but also significantly into the future.
You just can't say go outside and go to the library or something, meet some people. It doesn't work that way.
Well, that is a great idea. You know, if we think about the remedy, connection heals. We find injured animals that have social connection do better. They heal faster. We also find that animals that are stressed, if they are surrounded by familiar companions, they don't experience that stress as much. So I think there are three things people can do. Love your first idea. Just get out and talk to people. When we interact with others, we experience a micro boost in mood. Just that chit chat. In Holland, they actually have a slow line at the checkout line in the grocery store, just so people can chit chat and linger. And we've kind of lost that.
Can you imagine if we had that here? Wow.
Right. So, you know, make the time to make eye contact, say hello to a stranger. It might make their day, but you're going to experience that boost. So, you know, get out. Number two, contact old friends. And when you do that, ask meaningful questions. There's a protocol, the Fast Friends Protocol, out of Stony Brook University out of New York. And you can see that protocol, and they find just 45 minutes of asking these questions, strangers felt connected. They became fast friends. So look at a few of those questions and reach out to old friends you haven't seen. I had two friends contact me recently I haven't seen since the pandemic. I'm excited to see them. So reach out, or even with those friends you know. Try one of those questions. And then lastly, try something new where you can meet somebody. Like you have interests, hobbies, you can volunteer where you know like-minded people will be there. And try not to be shy. Just reach out and engage with somebody.
Join a gym?
That's a great way to do it. You get those endorphins, but also find that you know, you might just find a friend there.
Like-minded individuals.
Yeah, that's exactly it. Oh, that sounds great. Now, we just have to come out of our shells. Really, you know, there's some people out there who are just too shy, but it's like baby steps.
Right, and you know, there are people who are introverted that prefer being on their own, but you know, even if you can't meet face to face, even a phone call or a text, you know, again, even if it's one person where we feel seen and heard and understood, there's healing benefit. It increases that sense of productivity and sense of well-being when we feel that connection.
Absolutely.
Okay, thank you.
Thanks
Great
for
advice
having
as
me.
always. Thank you.